One of the questions that people have when seeking treatment is, how long do I need to do it? I'm always trying to empower people by thinking deeply about their questions. And so if you put that question back, it's how long is it going to take for me to change? And there isn't an exact number of days that you can say. So there's a model out there of 30-day treatment. Our program is a 90-day program, is a model of 30 days. Well, what is that based on? Is that based on some science that people break addictions in 30 days? Absolutely not. It's based on the way that insurance billing works. So it has nothing to do, 30-day model of treatment, with the kind of change that people need to have happen. The standard answer these days in recovery is around 90 days. I think that has more to do with the amount of time that people can afford to spend away from the system of their life, right? I mean, most people can't just drop out of their lives for 6 months or 9 months, unless you're young and maybe you have good insurance or you're supported by your family or you're getting resources from the county or the city or something like that. So the 90 days is sort of a compromise in my mind. It's trying to give people as much treatment as they can get, realistically. In my mind, 30 days, maybe you're starting to sleep good, maybe you're starting to feel safe, you're beginning to approach recovery, but you're nowhere near where you need to be to move on. By 90 days, you should have built a decent foundation, not a solid foundation, but a decent foundation. And the way that good treatment works is it's very immersive up front, but the goal of treatment is not to do treatment well. That's the trick, right? A lot of treatment programs, they do really good treatment, but the goal of treatment is not to do treatment well. The goal of treatment is to engage people in recovery so they can do their lives well. That's the real trick. And so the immersive experience up front, the experience of the recovery culture and knowledge and tools, understanding, therapy, psychiatry, all the things you need. And then you really want to kind of move that person into life to build those support structures outside that they have forever, that they can keep, that are sustainable, right? And so I think about it as like 90 days in relatively contained care. First 30 days real contained, second 30 days less contained, much more freedom in the third 30 days. And then you're back in your life, but still with a lot of support and resources that are pointing you towards the outside support continually. That's really good treatment, and it works phenomenally well when the circumstances line up to be able to do that.